Anxiety is the big issue in dentistry. I mean, full 50% of the population doesn't even go to the dentist. And typically it's because they have some anxiety about going to the dentist. That's one of the reasons why I like to get to know my patients. I want them to figure out that I am a human being, that I'm a nice guy, and I'll treat them well, that I care enough about them that I'll give them a blanket and I'll give them music to listen to, and we're going to make it as comfortable of an experience as we possibly can. We do have nitrous oxide, and that's kind of our entry level. Nitrous oxide, laughing gas, some people call it, is a way of taking away anxiety. It's almost like you're sitting in the next room listening to somebody doing dentistry on your mouth over in the other room. It just kind of takes the edge off, but the nice thing about nitrous oxide is 2 minutes after you're off of it, you can drive home. The next step that we have is we do oral sedation. Oral sedation is a really nice way of taking the edge off. What it does is it makes it so that you can participate in the care, you just don't remember you were there. It's that simple. It takes away the anxiety. You take a little pill the night before, you take a little cocktail that morning and put a little something underneath your tongue to help you relax. About an hour later we're doing dentistry and you're like, yep, no big deal. I really don't care. This is fun. And then we get all the dentistry done. It allows us to do a lot of dentistry all at once because you really don't care. Most people just kind of sleep the rest of the day, and then they get up the next morning and they're like, yeah, well, I had a lot of dentistry done yesterday, didn't I? Oh well, no big deal. It just takes away that anxiety and the frustration. Then we have the patient who really doesn't want to be here. I mean, literally in no way wants to participate in dentistry, but yet they have a lot of dental needs. And those patients need somebody to really make sure that they don't have to experience anything. And so what we do is we have an anesthesiologist come in, and the anesthesiologist uses hospital-grade equipment to monitor the patient, make sure that everything is taken care of. The anesthesiologist is there for one purpose, to make sure that everything is perfect during that sleep. And so the patient goes to sleep, we do our dentistry, and we can do a large amount of dentistry, getting implants and crowns and doing all kinds of things during that process, get it all taken care of so it's done. And then what we do is the anesthesiologist wakes the person back up and they go home. And it just makes it so easy on the patient because literally it's like they're not even there.